Hi, Kevin Henry, the Group Editorial Director for UBM Medica's Dental Division, and I'm on a Google Hangout today with my friend and a dentist based in San Antonio, Texas, Dr. David Little. How are you today?
I'm doing great, Kevin.
Thanks for taking a few minutes. Would you tell our viewers a little bit about your practice?
Yes, I am in full-time private practice in San Antonio. I've been in practice for 31 years. I'm also a adjunct clinical professor at the University of Texas Dental School here in San Antonio as well. My practice is a little bit unique in its multi-specialty. One half of my office is a complete specialty wing, so I have every specialty in dentistry rotates through my office one day a week, and they're not part of my practice. It's separate, but they actually rent from me, but we can treat patients and do everything under one roof.
Very cool. Absolutely. And you and I have worked together on a number of projects in the past, but today I wanted to kind of focus on an ebook that you worked with us on regarding CareStream CS 9300. And I wanted to talk to you about how you purchased digital equipment for your practice and some of the thought processes that went behind that. What was some of your main thoughts whenever you said it's time for me to pick this system? What went behind that?
Well, and I think with any technology investment you make, you need to make sure that you look at it from a workflow standpoint so that you can implement it in your practice and make it flow. And then also make sure that, everything talks to each other. I think that's the big thing is communication within your team and within using the technology to make it better. And at the very bottom line is it better for your patients and deliver better care? And I think that's kind of where we go with this. Now, in our office, we do a lot of implants. And so we also have, somebody that does endo and ortho and other things. So my first purchase was actually a smaller unit. It was the 9000. And that was more because I only really looked at segmental areas, a single tooth implant or I'm looking at an endo situation. Or looking if something in ortho, if the tooth was buccal or lingually, impacted. And so those kind of things worked great for us. And I think the other thing is I also looked at, I already had the sensors that I used and want to make sure all that works together. Same thing with your software, your practice management software. You want to make sure all that can be linked together and work together. So as I kind of grew, I realized that 3D was very important in the final analysis, especially with implants. So that's when I started sending my patients out to get that procedure done. So I'd send them to an imaging center. And I wanted to make it easy for my patients, so I would actually pay the imaging center and tell them, look, let them come in, get the scan done, and then just send them back. And I wanted to make it seamless and easy. So then I started noticing how much I was paying every month to do that for my patients. And so that's when it made sense for me to look at, hey, I should make this investment and look at it. So from an investment standpoint, yes. Does it make sense financially? Yes, it does. But that's not the biggest reason I got it. And I really was actually surprised when I got it. It wasn't just about implants. It is a patient that comes in with pain and you can't figure out where it is. And every x-ray you've taken didn't show anything. And they'd been somewhere else and they didn't see anything. And finally you take that x-ray and you go, wow, there's an extra canal or there's a fractured root. Or the same thing with that patient where you're trying to decide, should I do a retreatment of an endo and retreat the crown, or should I go to an implant? And so now you can look and see if the tooth is healthy, great, retreat it. If it's not, and if you see a fracture, then but you know that right away. And then in implant dentistry, no question, seeing the end before you start is, that's what it's all about. And with my unit, with my CareStream unit, with the 9300, I can take that radiograph literally while the patient's still there, do a little bit of virtual planning, and I can say, yes, you're a good candidate. And now we can do the real work of finding out what it is. And then you can use that information to go wherever you need to go. And in my case, since I'm doing a lot of big full mouth cases now, I can actually take a PVS impression, put it on my CareStream unit, scan that, and so everything is digital. So now I can do a digital smile design and plan everything together, and I think that's an important factor.
It amazes me because a lot of dentists still don't see the value or don't understand the value in 3D imaging. And yet, when I talk to clinicians like you, it's one of those, it's a no-brainer. It's one of those things that you'd never go back now and not have. Is that right?
That's exactly right. Once you've seen it and you see what it does and how much it benefits your patients, you could never go back. And I think as we progress, it's going to be the standard of care, if not already the standard of care. And the truth is, we're going to be held to that standard of care. When we look at things, people are always going to ask you if you have ever something go wrong, and let's hope that never happens. But if it does, they're always going to ask you, what did you do, on the front end to make sure you had the best diagnosis? And I think with 3D, that makes sure that you have the best knowledge that you can to treat that patient the best.
And I know you touched on it just a minute ago, but really, again, a lot of dentists don't understand that there's really an ROI here with 3D imaging and being able to, not have to send patients out, and treatment planning is so much easier. What would you say when people ask you about the ROI of this?
Yeah, and I definitely think that you cannot make an investment in technology without looking at the ROI. That's just, especially my accountant and my financial people always make sure that I see that first. And, one of the things is that from a strict bottom line standpoint, if I looked at just being able to provide that for my patients and billing it out in my office, it's already, and the ROI is already positive. But when you add in the fact that the convenience factor for the patient, being able to see that in real time right now, whatever situation comes up, and patients are really amazed at when you can show them what 3D does. And that's another thing, being able to do a treatment plan and sitting down and saying, look at this digital x-ray, how I can manipulate it and look at it. Look at this digital Panorex. Isn't it amazing how I can change things around? Now here's the bad thing. That's still a two-dimensional image. Now let me show you what happens when we do 3D. And then when you start rotating it, my patients look and go, that's me. And it's amazing how much they start owning it now. And so I think from that perspective alone, it's worth the investment.
Well, you can hear more of Dr. Little's thoughts on 3D imaging technology and the CareStream CS9300 in an ebook that we have worked with CareStream Dental on. You'll find the link in this trigger article right above this video. So Dr. Little, thank you so much for your time this morning and kind of your thoughts on technology and 3D imaging. I really appreciate it.
Kevin, always a pleasure to work with you. Take care.
Thank you. Bye-bye.